All right, this is a medical scenario. You, just as a reminder, you are on an ambulance. You have another EMT with you, and on this one, you have a fire truck responding with you with 3 other EMTs, but no paramedic. So if you want another paramedic or other resources, just let me know. So you are dispatched to a 24-year-old female who is at a restaurant and is having severe abdominal pain. So you're dispatched to that. It's reported that she had gone unconscious and is now conscious.
All right. So I'm on my way. Thinking, you know, BSI seems safe. I mean, it's at a restaurant. There's probably people there helping her. It's probably a lot of people. We're gonna have to manage a little bit if she's sick and passing out like that. She's got abdominal issues. We're at you know, at a restaurant, maybe thinking maybe she threw up or something. Got some gloves on just to protect myself from that. It sounds like we just got one patient. There's a fire truck and some EMTs on the way, so there should be plenty of help. Not that concerned with um, thinking about her C-spine or anything else. Like, just want to get in there
Okay.
and get a general impression.
Yeah. So you arrive on scene and you're directed to one of the booths. It's a sit down restaurant. And it's the fiance that gives you kind of an update. He says, "Hey, this is my fiance, Sarah. She's 24 years old. And we just got here and she's not been feeling very well all day. And then all of a sudden she got really pale and she passed out and she's complaining of lower abdominal pain across her whole stomach. And so I don't know what to do." So you look at Sarah and she just looks ill, but she is conscious. She does look at
Yeah,
you.
yeah. I mean, so with that information, I think my general impression is fair. I mean, she's alert, she's talking, but I mean, or she's conscious. Her fiance is talking for her. She has passed out once already, so that's not a good sign. And based on the fact that she has been complaining about abdominal pain all day, I would like think that it's medically related, not necessarily like a response to anything she ate at the restaurant or anything like that that might have exacerbated it. But yeah, she probably has something going on, like whether it's a stomach or reproductive or some sort of bleeding issue. But yeah, that kind of puts to rest any not puts to rest, but like yeah, be less concerned about an allergic reaction from the restaurant, but obviously want to continue talking with her.
Okay.
Um, chief
You can go
complaint,
ahead
I
and
mean, yeah, so general impression is kind of fair to poor, but chief complaint sounds like her abdomen pain.
yeah. So she says she's guarding her abdomen. You ask her chief complaint. She says that I think one of my ovarian cysts burst. I'm in so much pain right now.
Yeah, fair enough. I mean, that kind of gives it to you right there, honestly, if she's familiar with that. So first, I mean, she passed out. Maybe it was from the pain or from nausea. But if she's talking, she's alert. She's got a good airway. Want to get baseline vitals on her, kind of first thing. Um, and really, I mean, so yeah, knowing a little bit about my wife had fibroids, and so knowing a little bit about that, I kind of question her about if she's had this happen before. You know, yeah, get those vitals. Ask her if she's on any medications or if she's pregnant now, um, or nursing, or has had any.
Okay.
What kind of stuff would exacerbate that condition? I'm not super familiar with it, but like, yeah, I know, if you have a fibroid or something that bursts, can be super painful and lead to a little bit
Yeah.
of bleeding.
Yeah. So let's take a few steps at a time here.
Yeah.
She does have a good airway. She is able to breathe. She's breathing. She has no difficulty breathing. It's just when she's guarding, she's kind of grunting when she breathes because it hurts. So you asked about vital signs, and for circulation, you have a pulse of 96. What other vital signs do you want?
I'd like to get her blood pressure. Um, you said she's got good respiratory rate, so I don't necessarily need to put a number on that.
Sh- She's breathing at 18 breaths per minute. She has a blood pressure of 128 over 72. Any
Okay.
other vital signs you want?
Um, yeah, probably try and take her O2 stat, um,
Okay. O2
saturation.
saturation is 99%
Sweet.
on room air. So you asked about medications. She does not take any medications. She's been taking some Tylenol and ibuprofen over the counter just for the pain, and she is not pregnant.
Okay. Is her um, skin color look okay?
Skin, skin color is pale, cool, and diaphoretic,
Okay.
slightly diaphoretic.
Yeah. Um, so I guess I'd first be asking about going through OPQRST to find out when the pain really started, um, what's making it better or worse, if eating made it worse, if the ibuprofen or anything like that helped or not, where exactly she's feeling it, if what quality, if it's radiating, and yeah, the severity and how long it's been going on, if it's got, yeah. I mean,
Sure.
it's saying it's in her lower abdomen. I'd be thinking a little bit more when she claimed with the ovarian cysts. I'd be thinking that a little bit more than in her stomach, um,
Okay.
due to some medications but
Yeah. So the onset about 5 days ago, she started having this pain that was different. She scheduled an appointment with her OBGYN. She had an ultrasound done and confirmed that she has 3 ovarian cysts, one that was actually very large, and she didn't describe how very large was. So she knew she had these cysts. They told her to take it easy. She wanted to go out and have something to eat, and now she's experiencing excruciating pain. She rates that pain at the quality of pain is a sharp pain that's kind of stabbing. It is just radiating around her stomach. The severity is a 9 out of 10. And then tea time is now, uh, since it started happening during this incident, it's now been about 25 minutes.
yeah, okay. I mean, her vitals aren't super alarming. But the amount of pain she's in and saying it's been going on for 5 days, and she had confirmed she has cysts, and that sounds like probably one of them burst. I mean, I'd be thinking about having a medic or advanced EMT to be able to give her some pain management, to come and help out with that, because that's really I mean, I'm not super familiar with that, like what else you can do really, but kind of help her with the pain. And then we'd be thinking about getting her transported, um, to make sure she doesn't have any like serious bleeding associated with that ruptured cyst, if that's what it is.
Okay.
But I'd be
You've asked
taking,
about bleeding, and there's currently no associated vaginal bleeding or any other bleeding
yeah,
yet.
yeah, yeah. I mean, that's good, but if it's in her reproductive tract. It might be, if she is bleeding, it could be caught up in there.
Okay.
So,
So we're
um,
we're now transporting. I'll tell you, your medic's about 4 minutes away. They're going to rendezvous with you.
sweet.
So, is there anything else you'd like to do in between that transport from the restaurant to the medic?
Yeah, I mean, I guess we talked about a sample history, so I know she's on Tylenol and Ibu. I want to make sure she's not allergic to anything. I don't know if I was explicit about the sample history, but yeah, I want to make sure she's got no allergies or no
Yep.
other big medicines. I knew when she ate last, and kind of what happened leading up to the pain. So you got that knocked out. I'd want to be um, doing. I want to get another set of vitals, especially on her blood pressure, um, and kind of. I mean, I'd be thinking about a secondary assessment on like everything she's got going on in terms of like um, just how she's feeling, making sure she's got no um, other big complaints. Honestly, I think for something like this, it's like, you got all her other systems or whatever, cardio and pulmonary and neurologic, but I'd be most concerned with like her um, her reproductive and kind of her like psychological health at this point, just to see how
Okay.
she's feeling. I think those things can be pretty. I mean, I imagine it would be pretty scary to feel that pain and not really know what you can do, or
Hmm.
um, so just trying to manage that and make sure she's mostly concerned with if there's any bleeding inside of her associated to that.
Okay. Let me go back to the sample history. You know the signs and symptoms. She has no allergies. She for medications, it's just that Tylenol and ibuprofen. Past pertinent history, ovarian cysts. That's it. Last oral intake was a bowl of oatmeal this morning for breakfast. Events leading up to it, we've already gone through that. You take a second set of vitals, and everything is very close to what it was before.
Okay.
So if there's nothing else you want to do, go ahead and give me a patient care report as if I'm the medic.
Yeah, honestly, I mean, I don't know if there's much else I can do. Yeah, I feel pretty good about passing her off, I think. Where did I write? We've got Mary, a 24-year-old female. She was reported to be unconscious and complaining about severe pain in her lower abdomen. She was diagnosed recently with 3 ovarian cysts and believes that maybe one of them ruptured. She was told to take it easy, but she went out for a meal. That's her chief complaint, really only complaint. I guess I wasn't super clear on her time of being unconscious. I might have wanted to make sure she didn't hit her head or um, anything like that, had trouble breathing, or yeah, I probably could have been a little
Good.
bit more concerned with that, um,
Okay.
and her LOC in terms of who, what, where, when. She makes sure she knows all that going on. Um, Assuming that was all good. Yeah, she did spend some time. She did go unconscious for a moment because of the pain. It sounded like her pulse was 96, blood pressure is 128/72, and O2 saturation was 99%. She's a little diaphoretic. She's taken Tylenol and ibuprofen. No vaginal bleeding, but she does have severe pain and cramping in her lower abdomen. Um, yeah, and we took a second set of vitals on the way over, and it was pretty similar to those first
Okay.
ones.
All right. So it's in this scenario, and can I talk about it? I thought you did a really good job. You came back, got the sample history. You initially just asked about meds and pregnancy, and it
Yeah,
really hit the rest. But I think you redeemed yourself. You went through OPQRST. You asked a lot of good questions. about this particular incident. Here's some couple other things that you could do in addition. Last menstrual cycle, should she be bleeding right now, or is she not? For vital signs, blood glucose. Again, did she pass out because of low blood sugar? If she's
Yeah.
conscious now, that's probably not the case, but you just don't know. And I didn't, a good catch on, how long was she out? It was 30 seconds, and no, she did not hit her head. So probably one of the biggest things for you to consider, and maybe you did, but I didn't outwardly hear it, but that would be more of a focus assessment on that area. Now, you did do a focus verbal assessment, but I'm looking more so palpating where that area is. Is there rigidity? Will she just not let me touch it? What's going on there? Is there any bruising?
Yeah.
You should rule out that, she said it was ovarian cyst. I tend to believe her, but I would like to get a visual of that. Maybe she was, maybe this is a result of a domestic dispute. She was punched in the stomach and there's bruising. Where does
Yeah.
bruising come from? You just don't know. But
Yeah.
that's not what this was all about. And so good job. I want to take a moment and talk about the unknown. So responding to a female like this with ruptured ovarian cyst is not something that we go to a lot of. And you're not expected to be an expert on everything that we can encounter. It's really nice and helpful to have personal firsthand experience of what happened to maybe a loved one or whatnot. But there's a lot of crazy illnesses out there that affect people in different ways. But like I said, it's nice when you do know a little bit, but your treatment's going to be the same.
Yeah.
Chief complaint, ABCs, vital signs, focused assessments, if not a full head to toe, reassessments, and then transport. So that's the good thing about that. But I like the fact that you were able to kind of pull some of those questions that weren't so black and white and put them in this scenario. So good job.